So I think that that's really important to point out, that I think that our listeners have what I would call, I refer to it as like, and it's not to say that they need to pivot at each one of these areas, but it's something to
Sure.
confront. Do I need to pivot my business model? Do I need to
Yeah.
pivot my marketing? Do I need to pivot my
Yeah.
sales? Right. And so I think the example that you just gave is you don't need to pivot your business model. It's still very valid in the midst of COVID. What
Yeah.
I hear you saying is the messaging's changing, right? So like a
Yeah.
month ago, you wouldn't have had COVID on your website. You wouldn't have had
Sure.
COVID in your elevator pitch. And now it makes it more, tweaking that messaging allows it to
Yeah.
be more timely and relevant, and
Yeah.
eliminating any guesswork of how your solution could fit the need that people are experiencing right
Right.
now.
Yeah.
Yeah.
I think that's a really fair way to put it. And, I'm not sure how this will apply to other digital health companies, right? We just, got lucky. I don't know what the word is, in that we're actually positioned to, with the technology we already have, do something that's so directly relevant. I do agree, though, with your kind of previous comment or observation that now is a good time to try to take a step back and try to think. It's what we're trying to do too. Think really hard about what's the world going to be like in 6 to 8 weeks and beyond, and how will we need to change as a result of that. We're not immune to that either, right? So we're trying to think really hard about, and it's hard because we're just all in the weeds every day with COVID, but we're trying to sometimes take a step back and think about how do we strategize 2 or 3 months from now to kind of come out of this, whether that's repositioned or doubled down, or how is our messaging going to change, and how are we going to go after our target market? Like all those same questions, right? So I do think now it's an important time for everyone to take a step back and try to think about that, because it is likely the case that things won't be the same.